There's a test you can do right now, sitting exactly where you are, that tells you more about what's happening inside your legs than almost anything else you could check at home. Press one finger into your shin, right above the ankle bone, hold it there for 5 seconds, and let go. If the little dent you left behind is still sitting there 10, 15 seconds later, your body is trying to tell you something about a pump that's been running quietly since the day you were born, and after 60, that pump starts asking for help. Stick with me, because in a few minutes I'm going to show you the one movement. It's not a walk, not a stretch, something smaller and stranger than that vascular researchers keep coming back to when they talk about restoring circulation in aging legs. And I'm going to explain exactly why it works, not just tell you to do it. But first, let's talk about why your legs, specifically, are the part of your body where this shows up first. Your heart is an incredible pump. There's no arguing with that. It pushes blood out to every corner of you with each beat. But here's the part almost nobody explains clearly. Getting blood out to your feet is the easy part. Gravity helps with that. Getting it back up from your ankles, through your calves, all the way up to your heart, that's the hard part. And it's a job your heart mostly hands off to something else. Your calf muscles, every time they contract, they squeeze the deep veins running through them like someone stepping on a tube of toothpaste, and that squeeze pushes blood upward against gravity back toward your chest. Physiologists have a name for this. They call it the skeletal muscle pump, though some call it more simply your second heart. And here's the thing about a second heart. If you stop using it, it doesn't stay strong just because the first one is. Think about what a typical day after 60 can look like. More sitting, more time in a car, at a desk, in a recliner. Nothing wrong with any of that on its own. I'm not here to shame anyone's chair, but every hour your calf muscles sit still. That second heart isn't pumping. Blood pools, pressure builds in the small veins near your ankles, fluid starts to leak out into the surrounding tissue, which is exactly why so many people notice their socks leaving deep marks by the end of the day, or their shoes feeling tighter in the evening than they did that morning. That's not just getting older. That's a mechanical problem with a mechanical explanation. And this is the part that matters most, a mechanical fix. Now, I want to be careful here because there's a difference between everyday sluggish circulation and something that needs a doctor's attention. And I'd be doing you a disservice if I blurred that line. If you're noticing one leg swelling more than the other, skin that's turning reddish brown or hardening near the ankle, wounds on your lower leg that aren't healing, or pain in your calf that shows up specifically when you walk and disappears when you rest, that last one especially can point toward reduced blood flow in the arteries, not just the veins, something called peripheral artery disease, and that's absolutely worth a conversation with your physician, not a YouTube video. What we're talking about today is the everyday kind of poor circulation. The puffiness, the achiness, the restless legs at night, the feet that feel cold even in a warm room, the kind that researchers studying venous health in older adults have repeatedly linked to one very fixable habit: how much and how often your calf muscles actually contract throughout the day. There was a study, a modest one, done with a group of older adults who spent most of their day seated, that measured something called venous flow velocity, essentially how fast blood was actually moving back up through the leg veins. Before any intervention in the people who sat the longest, that flow had slowed to what researchers described as a near stagnant pace in the lower leg. Then they introduced a simple seated movement, just a few minutes, several times through the day, and the flow velocity picked back up. Not to a dramatic degree, nobody's claiming a miracle here, but enough that several of the researchers involved noted it was comparable to what you'd see from a short walk, which tells you something important. It's not the walking itself that matters, it's the muscle contraction. And that means you don't need to walk to get the benefit. You need to activate the pump. So here's the part most people get completely backwards. They hear poor circulation and their instinct is either, I need to walk more, or I need compression socks. Now, walking is wonderful for you. I'm not knocking it, and compression socks have their place too, especially if a doctor has recommended them for a diagnosed condition. But neither of those is the fastest, simplest way to wake up a sluggish calf pump when you're sitting at your kitchen table right now. What actually does that job, according to the vascular physiology, is something almost embarrassingly small, the ankle pump. Let me describe it because I promise you it's not what you're picturing. You sit with your feet flat, or even better, elevated slightly if you can manage it comfortably, and you point your toes down as far as you comfortably can, like you're pressing on a gas pedal. Then you pull them back up toward your shins as far as you comfortably can, like you're trying to touch your toes to your knee. Down, up. That's it. That's the entire movement. No equipment, no getting up, no special clothing. But here's why it isn't as trivial as it looks. When you point your toes down, your calf muscle, the gastrocnemius and soleus, contracts hard. When you pull your toes up, a different muscle group along your shin contracts. Back and forth, you're alternately squeezing two separate muscle groups that both compress the deep veins running through your lower leg, and each squeeze pushes a fresh pulse of blood upward toward your heart, past a series of one-way valves designed to keep it from sliding back down. It's less like exercise and more like ringing a bell. Short, repeated, rhythmic pressure, exactly what those valves and veins are built to respond to. Now here's where I want to give you something more useful than just do ankle pumps sometimes, because vague advice doesn't change behavior. I want to walk you through what I've started calling, for lack of a better term, the second heart reset, a specific way of using this movement so it actually does something measurable instead of becoming another thing you mean to do and never quite build into your day. The first piece of the second heart reset is frequency over intensity. This is the mistake almost everyone makes when they hear exercise for circulation. They picture doing one long, intense session and being done for the day the same way you'd think about a workout, but circulation doesn't work like muscle building. Blood doesn't stay pooled just because you moved it once at 8 in the morning. If you sit still from 9 to noon, it pools right back up, no matter how vigorously you pumped your ankles at breakfast. So instead of one long session, the second heart reset works in short, frequent bursts. Roughly 60 seconds of ankle pumps, done once every hour you're seated, not once a day, once an hour. That's the single biggest shift in thinking that makes this actually work. The second piece is elevation, when you can manage it. If your legs are hanging straight down off a chair, gravity is working against every pump you do. You're pushing blood uphill the entire time. But if you can prop your feet up, even just on a small stool or an ottoman, 12 to 18 inches or so, you've already tilted the playing field in your favor before you've even started moving. You're not fighting gravity as hard, so each contraction does more work. This is why so many people notice their ankles look less puffy after a night's sleep. You've been horizontal for 8 hours, and gravity simply hasn't been working against your circulation the whole time. We're trying to borrow a little of that benefit while you're still awake and sitting up. The third piece, and this one surprises people, is temperature. There's a reason your feet feel worse by the end of a long day sitting somewhere cold, like an office with the air conditioning turned up or a car in winter. Cold causes the smaller blood vessels near the skin's surface to constrict, which is your body's normal way of conserving heat, but it also means less blood is moving through those surface vessels to begin with. If you're doing your ankle pumps in a cold room with cold feet, you're working against a second obstacle on top of gravity. Doesn't mean you need to bundle up in blankets, just something as simple as wool socks, or doing your 60 seconds after you've been up and moving a bit, and your feet have warmed slightly makes the exercise noticeably more effective. Let's pause here for a second, because I want to ask you something. Think back to the last time you noticed your ankles were swollen, or your legs felt heavy and restless right before bed. Can you remember what you'd been doing for the few hours before that? I'd put real money on it being a long stretch of sitting, a car ride, a movie, an afternoon at a desk. That's not a coincidence, and it's not just getting older doing that to you. That's your second heart, sitting idle, exactly the way your first heart would if you asked it to stop beating for 3 hours and then complained your circulation felt off. Now, some of you are probably wondering whether this actually adds up to anything real, or whether I'm just describing a nice-sounding ritual. So let's talk about what's actually happening physiologically when this becomes a habit rather than a one-time thing. Chronic venous insufficiency. which is the medical term for veins that have lost some of their ability to push blood back up efficiently, something that becomes more common as we age, partly because the valves inside those veins can weaken over decades of use. Doesn't develop overnight, and it isn't reversed overnight either. But researchers who study non-surgical management of early venous insufficiency have consistently pointed to calf muscle pump activation as one of the few genuinely evidence-supported side effect-free interventions available. It won't rebuild a damaged valve, but it can meaningfully reduce the pooling and pressure that make the existing situation worse day to day, which is often exactly the difference between legs that ache by 6 p.m. and legs that don't. There's also a piece of this that connects to something bigger than comfort, and I think it's worth naming plainly rather than dancing around it. Poor venous return over long periods has been associated in the research with increased risk of blood clots forming in the deep veins of the leg, something called deep vein thrombosis. This is more of a concern during long periods of complete immobility, like a long flight or a hospital stay, than during a normal day of sitting at home. But the mechanism is the same one we've been talking about the whole time. Still blood in a vein with weakened one-way valves is blood that has more opportunity to clot. This is actually why flight attendants have told passengers for decades to flex their ankles during long flights. It's the exact movement we've been describing this whole time, just applied to a specific high-risk situation. What we're doing today is taking that same well-established principle and building it into an everyday habit, not just a travel precaution. So let's bring this together into something you can actually start today, because information without a clear next step just becomes another thing you forget by tomorrow. Here's the practical version of the second heart reset, broken into 5 simple pieces. Number 1, set an hourly reminder, your phone, a kitchen timer, whatever's easiest, for every hour you expect to be sitting for an extended stretch during the day. Number 2, when it goes off, do 60 seconds of ankle pumps. Point your toes down as far as comfortable, then pull them up towards your shins as far as comfortable. Aim for a steady, unhurried rhythm, roughly 1 full cycle every 2 seconds, so you're getting around 30 repetitions in that minute. Number 3, if you're able to, elevate your feet slightly while you do this. A low stool, an ottoman, even a stack of books works. 12 to 18 inches off the floor is a reasonable target, though even a small amount of elevation helps. Number 4, pay attention to your feet's temperature before you start. If they're cold, consider warming them slightly first, whether that's socks, a blanket, or simply standing and moving for 30 seconds before you sit back down to do the pumps. Number 5, and this is the one people skip because it feels less important, but it isn't. Once a day, ideally in the evening, take 30 seconds to actually look at your lower legs and ankles. Are they puffier than usual? Is there a new area of discoloration? Is one leg noticeably different from the other? You don't need to obsess over this, but building in that daily glance means you'll actually notice if something changes, rather than a gradual shift sneaking past you over weeks. And if you do notice something that seems off, real swelling, unusual color, pain that doesn't match anything you've done that day, that's worth mentioning to your doctor rather than something to try to exercise your way through. I want to be honest with you about something else too. This one small movement is not going to undo decades of vein wear, and it's not a substitute for medical care if you already have a diagnosed circulatory condition. What it is a genuinely evidence-backed, zero-cost, zero-risk way to give your second heart the workout it's been missing every single hour you sit still. And for a lot of people, that alone is the difference between legs that feel heavy and swollen by evening and legs that don't. Small, unglamorous, repeated often, that's usually how the body actually responds, far more than any single dramatic fix ever does. If you try this for a week, I'd genuinely like to know what you notice. Drop a comment and tell me whether your ankles feel different by the end of the day, or whether that 5-second press test at the start of this video leaves a shorter lasting dent than it did before. I read every one of them and it helps me know what to dig into next. And speaking of what's next, there's a companion piece to this that I haven't covered yet, about what's actually happening while you sleep that either helps or completely undoes everything we just talked about, and why the position you sleep in might matter almost as much as the exercise itself. I'll be walking through that one soon, so keep an eye out for it. If today's video gave you something useful, consider subscribing. I'm building this channel around exactly this kind of thing, real mechanisms explained plainly, one small habit at a time.